In a little more than 100 days, the Trump administration has upended the U.S. health care system Americans love to hate, sparking turmoil and confusion. The Trump administration calls its sweeping changes a critical course correction to the way the nation delivers health care. This is not just policy, it's a revolution in public health, HHS Secretary Robert F. Kennedy Jr. said in an April 29 statement touting the administration's accomplishments. On the administration's list of accomplishments, a new commission to end childhood chronic diseases, a review of infant formula safety, an investigation into the causes of autism and an effort to reduce animal testing. HHS also plans to review whether fluoride is safe to add to drinking water, despite decades of evidence that it supports dental health and poses no substantial risks. But some people on the front lines of the health care system, doctors and nurses, researchers, advocates and local officials, criticize the rapid-fire overhaul as reckless, and say it will cost dollars and lives. More than 70% of Americans say the health care system isn't meeting their needs in some way, according to a recent poll, yet it can still get worse. Millions of people are likely to lose health insurance under policy changes and expected cuts to Medicaid and other programs. Tariffs are expected to push up drug prices. A healthy school lunch program was terminated. Critical research trials have already been canceled midstream. Although states will continue to address childhood lead poisoning, the federal workers they counted on for expertise have all been fired. And Trump's proposed fiscal year 2026 budget calls for a 37% cut to the National Institutes of Health, which includes the National Cancer Institute. Already announced cuts to the country's research infrastructure will trigger roughly $16 billion in economic losses and 68,000 jobs nationwide, according to the Science and Community Impacts Mapping Project (SHMAP), which has mapped the economic impact of the cuts on every county in America. And Trump is proposing to chop the National Institutes of Health budget by 40% next year. Among its other actions, the administration has suspended testing of milk quality, saying that states can adequately perform this function, as well as cancer research funding, support for LGBTQ youth considering suicide and money to investigate child sexual abuse and internet crimes against children. These are reckless, thoughtless cuts that will only make American communities less healthy and less safe. Drive. Richard Besser, president and CEO of the nonprofit Robert Wood Johnson Foundation, said in a statement. They are systematically and cruelly dismantling our nation's public health system and workforce, which threatens the health and well-being of everyone in America. Dr. Richard Besser on the podcast. RFK Jr.'s impact on HHS so far has some worry. The excerpt: drug prices may come down, or may not. Trump has criticized President Joe Biden's plan for slowly lowering the price of select, popular medications. On April 15, he announced his own drug price reduction proposal in an executive order. Medical experts say it's not yet clear how Trump's plan will work in practice. Drug prices may come down, or may not. Trump has criticized President Joe Biden's plan for slowly lowering the price of select, popular medications. On April 15, he announced his own drug price reduction proposal in an executive order. Medical experts say it's not yet clear how Trump's plan will work in practice. Some of these proposed reforms could assist patients struggling with high drug prices, others would face significant legal and practical obstacles, and still others might even increase drug prices. Rachel Sachs, a former senior advisor at the Department of Health and Human Services, wrote in a recent article in Health Affairs. While Trump's initial round of tariffs left pharmaceuticals exempt, many of the raw materials that go into drug making are expected to increase in price, making it harder and more expensive to get these ingredients. There are clearly going to be tariffs that impact pharmaceutical supply chains. Tom Krause, of the American Society of Health System Pharmacists, which represents hospital pharmacists, previously told USA Today. Generic drugs which account for the vast majority of prescriptions have small profit margins and are more likely to feel the financial squeeze from tariffs, he said. A number of major drug companies have forecast hundreds of millions of dollars in extra costs from the tariffs, which could end up being passed on to consumers. In a win for the administration, which aims to bring manufacturing back to the United States, drug maker Roche announced on April 21 that it would invest $50 billion in building new manufacturing capacity, creating 12,000 jobs across 5 states. Planned cuts to Medicaid. Across the country, local officials and low-income Americans are preparing for dramatic cuts to Medicaid, which serves 78 million low-income and disabled Americans and is funded with a combination of federal and state dollars. Any cuts will have a ripple effect across the country, public health experts and health care advocates said, and even conservative activists like Laura Loomer have advised against chopping Medicaid because of the expected political fallout from Trump supporters. Trump has repeatedly promised he wouldn't touch Social Security or Medicare, but cutting Medicaid will harm the same people who receive those programs, Amber Christ, a managing director at the advocacy group Justice in Aging, said in a recent webinar. Roughly 30% of Medicaid spending supports Medicare